Okay, we're beginning to look at sterile products, and so we are. Um, this has been a relatively long chapter. All right. So again, sterile products. When selecting medication vials for current IV products, it's important to pay attention to the type of vial. Again, the final preparation should be inspected for physical and chemical incapabilities. We talked about that. And some medication requires special preparation, such as epidural. Very, very important that those are kept sterile. And then certain IV medication have short stability or expire soon after preparation, usually between 1 to 6 weeks. Okay. Um, this is general hospital issues. Remember, there's a fundamental difference between a community pharmacy and a hospital pharmacy. A hospital pharmacy, you're on the location where there are a lot of patients. So hospital employees are required to meet some of the conditions of employment that may not be required in a community pharmacy setting. They just like with, however, just like with community pharmacies, um, all hospital employees must undergo a physical exam and drug testing. New employees are required to attend hospital-wide orientations. If a technician has previous experience working in a hospital pharmacy, he or she will go through training. And of course, like many jobs, there's a probation period. All permanent employees review an annual or semi-annual performance or go through a semi-annual performance review, which can also occur within a community pharmacy setting. So what are some of the issues that you find within a hospital? Again, physical exam, drug testing. An employee has to attend hospital-wide orientation. There is a probationary period, and then there are performance reviews that could be yearly or every 6 months. And there are different types of agencies that regulate hospitals that you do not necessarily see associated with community pharmacies. And also there are agencies in which there are cross regulation. For example, the DEA. Every physician there must have a DEA number. Every drug has to have a DEA number. United States Pharmacopoeia. Very important in terms of listing the different type of drugs and what can be done. State board of pharmacy, just like community pharmacy, need to be regulated by the state. They do the same for the hospital pharmacy. The Department of Public Health. We may not necessarily see that a community pharmacy unless there's some type of compounding challenge. But you do see the public health very aware of hospital settings, and then a lot of times there are Medicaid, Medicare um, individuals who are having Medicare or Medicaid services going to a particular hospital. So when we talk about Medicare, we're talking about insurance provided by the government for the elderly. When we talk about Medicaid, the insurance provided by the for the poor. And then the Joint Commission, which regulates hospitals. Safety. All right, cold carts. Carts with medication and equipment commonly used in medical emergencies. Here is a picture of it here. There's universal precautions, practices, and guidelines that reduce the probability of exposure to bloodborne pathogens, such as the use of protective barriers, gloves, gowns, masks, and protective eyewear. Material safety data sheets containing information for handling of harmful chemical substances or drugs. And then shop containers, a red container designated for disposal of used needles and other items that may cut or puncture skin. There used to be a time in which we used to try to recap needles. They just threw the whole thing away at this particular time. A lot of people are getting punctured with the needle. Okay, so those are some of the things that are used for safety in a hospital setting. So during safety training, employees learn universal precautions and how to handle substance spills. For example, some medication can be hazardous to personnel. So again, goes back to the training and how to deal with those particular situations. And then the proper waste disposal of is very, very important, whether of containers that they contain drugs, syringes, IV bags, etc. All right, calculations. Here is something that is very, very important. We talked about calculations much earlier, and the same type of calculation you find associated with the pharmacy. You find community pharmacy, you find with the hospital pharmacies. So many different types of calculations are performed by hospital pharmacy technicians on a daily basis. Some hospitals require technicians to pass a calculation test prior to completing their training. So what does that mean? Drawing up unit doses, syringes, calculating flow rates and drip rates, determining time of subsequent doses, performing percent calculations, calculating the amount of drugs and diluents needed for SVP, you know that's small volume parenterals, LVP, large volume parenterals and dilutions. Many different types of calculations are performed by hospital pharmacy technicians on a daily basis. All right, let's look at an example. Drawing up a unit dose within an oral syringe. And here's the question. When a pharmacy technician have to manually draw up a unit dose oral syringe, there are important calculations involved. For example, a medication order read may be the following: gabapentin, 200 milligrams, NGTID. The question is, if gabapentin is available in 50 milligrams per milliliter concentration, how many milliliters of the drug should be drawn up per dose? And the calculations is the following. Solving for X, you get X equals 6 milliliters. So question number 2, how many syringes are needed for a 24-hour supply? Since this is given 3 times a day, we need 3 syringes. Okay, so this completes chapter 16, hospital pharmacy. What we need to do is go back to the beginning. So let's go ahead to the beginning and look at thinking it through. And see if you can answer these particular questions here. And just to recap, Sam is a hospital pharmacy technician worker in an oncology pharmacy satellite in Metropolitan Hospital. Dr. Stewart calls from the bone marrow transplant unit to give a telephone order for standard intravenous potassium chloride dose. Sam tells the doctor the pharmacy is on the other line. Dr. Stewart replies impatiently that he's in a hurry. And the question is how to respond to the doctor. So in a hospital setting, is the pharmacist that takes the order and verifies the order. So Sam had to tell the doctor to hold on. Okay, so the pharmacy technician cannot take the order. In the community, You can take a prescription, but it must be verified by the a pharmacist. So what information should Sam look up in the computer system to help? Basically, he is looking at for that particular patient, past dosage that would have been given to that particular patient. But in essence, he has to get the verification and sign off from the pharmacy. So the pharmacist must verify the prescription in the hospital setting. All right, that is it. Thank you and have a good day.